Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Kashmala Qasim and I'm applying for the lecturer position at the Islamic Online University's Department of Psychology. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي ربنا زدنا علما. Ameen. Okay, so to start off, I would like to tell you a little bit about myself. Alhamdulillah, I've graduated from the University of Toronto, Scarborough campus, and I finished my undergraduate studies over there, specializing in psychology. And within the psychology program, I was also part of the co-op department of the co-op program. And the co-op program really allowed me to experience sort of the world of psychology outside the university, outside books, and I was able to see both the clinical as well as the research side of psychology. Upon completion of my undergrad studies, I went on to complete the Ta'lim al-Quran diploma course at Al-Huda Institute, and it was about an 18-month course, and we covered word-for-word translation of the entire Quran, alhamdulillah, as well as tajweed, tafsir, du'as, aqidah, fiqh, Arabic grammar, sort of the entire realm of Islamic studies, alhamdulillah. After graduating from Al-Huda, I decided to pursue my master's in neuroscience at McMaster University. And although the program was neuroscience, my thesis topic was more related to mental health and looking at which psychosocial factors affect obesity as well as weight loss for patients who are undergoing bariatric surgery such as gastric bypass surgery. During my time at Masters and during my time in the Master's program at McMaster University, we had the opportunity to TA different courses as well, and I was a teaching assistant for a second-year course in research methods, and I thoroughly enjoyed that. The grading, sort of presenting, preparing course outlines, checking homework, the whole bit. So I was really thrilled to be a TA, and alhamdulillah, I did win a couple of teaching assistant awards, and I got nominated by my students as well, alhamdulillah. So I really enjoyed it, and I hope my students enjoyed the teaching experience as well. During the last year of my master's program, my peers and I actually got funded for a community engagement program called SPICES. And SPICES basically is an acronym for a much longer name, which is Student Proposed Projects for Intellectual Community Engagement Scholarship, or SPICES. And what the graduate faculty wanted us to do was to basically go out there into the community and talk about our research within sort of a community context. So for us, we thought, okay, why not go out to the Muslim community? So we thought we'll go out to the Muslim community, we'll visit different mosques and do workshops that talk about our research. And we focus primarily on obesity and nutrition, fitness and sort of physical activity, as well as mental health and psychology. And alhamdulillah, till now, we've done about 30 or so workshops at various different mosques across the GTA. And alhamdulillah, they have been very well received. And the whole point of these workshops is to combine scientific research, empirical findings, with Islamic principles. And something that is practical and it's not too research-based and that the general community can't benefit from. So that was sort of my graduate career, and I've been working with the SPICES team till now. It's been about 2 years or so, and we got funded as well, so it's renewable funding, so we're still working on that. During this time also, I want to combine some of my clinical psychology experience from my undergrad studies. So I applied for a pastoral counseling, or you can say spiritual counseling program at UFT, which is called the Muslim Studies program. And this counseling program allows students from every single religion to combine psychotherapeutic techniques with their own religion. So alhamdulillah, as part of my internship, I'm seeing patients every week at Al-Huda Institute, and I'm able to combine sort of my Quranic studies with the psychotherapy and the counseling training that I'm receiving at UFT as well. And finally, I just recently got the news that alhamdulillah, I've been accepted into the PhD program at York University. So inshallah, I'll be continuing I'll be starting my PhD studies at York University next year, and this will be in the Department of Social and Personality Psychology. Okay, so that's just a little bit about myself. We'll get right into the lecture material and the PowerPoint slides. I've decided to focus today's lesson on testing and assessment in psychology, and we're going to talk primarily about neuropsychological assessment. So just a quick outline for the class today. We'll go over learning objectives and sort of talk about why we're here, what we're here to learn. Secondly, we'll get into the history of neuropsychology. Next, we'll talk about who a neuropsychologist is, because sometimes it gets a little bit confusing with regards to psychologists, psychiatrists, psychotherapists, so we'll delve into that a little bit as well. Then we'll go right into the goals of neuropsychological testing, followed by the different methods of testing. And then we'll talk about commonly used tests, and then we'll end off with the causes of brain injury. And just as a note, this is not a comprehensive sort of presentation on neuropsychology. It's just a 10-15 minute presentation on just a brief introduction to one form of psychological testing. There's many other forms out there. This is just one type, and it's neuropsychological assessment. Okay, so the learning objectives for today, I would really like my students to understand what the field of neuropsychology entails and how it contributes to diagnoses as well as treatment. Secondly, I would like you to be able to understand the concepts of functionality as well as localization in the brain. Third, I would want you to understand the correlation between brain injury and behavior. And finally, and this is a little bit outside the scope of this course and this lecture presentation, but I really want you to be able to start thinking about neuropsychological theory and how it may apply to the clinic. So working as a neuropsychologist, what can you take from the theory to actually conduct neuropsychological tests? Okay, so a quick history lesson about neuropsychology. Two names really pop up if you look at the history of neuropsychology, and they're basically Doctors Wilder Penfield and Brenda Milner. So Dr. Penfield actually was a physician. He was not even a psychologist, and he worked with patients who had epilepsy. So he's really familiar with sort of the brain anatomy and seizures that were going on, but he wasn't really able to see the correlation between the brain injury and the behavior. Dr. Milner then really sort of built up on his work and used many of his patients to basically find the theories that we now refer to as part of neuropsychology. And she was really able to give us that insight into the interaction of the different hemispheres in the brain, how it relates to cognitive learning, language, emotions, sensory perception, and these are all things that modern day neuropsychologists use till today. Okay, so before moving on, we're going to talk about a few definitions so we're all on the same page. So the first definition with regards to neuropsychology is functional integrity. So functional integrity, in just very sort of simple English and lay terms, is whether or not a specific function in the brain is intact or impaired. So for example, something like short-term and long-term memory, numeracy, attention, language skills, motor perception, motor movement. Are these things impaired or are they intact? Secondly, we look at localization in neuropsychology, and localization basically is whether or not any specific part of the brain, so we're looking at the neuroanatomy now, so whether or not any specific part of the brain is functionally intact. So to put it very simply, functional integrity is whether the cognitive side of things are working. Localization is whether or not the actual part of the brain, whether it's intact or not. And just a quick disclaimer here before we move on is that the neuroanatomical map is not so simple. So we know the brain is very complex, and it's not so easy to say that, okay, just because someone's hippocampus is not intact or the prefrontal cortex was injured, that automatically they will have a memory problem or automatically they'll have an emotional dysregulation. So it's not just a very simple one-to-one map, because many parts of the brain contribute to many different behaviors. It's not just one thing refers to one behavior. Okay, so in terms of the field of neuropsychology, who exactly is a neuropsychologist? What kinds of assessments do they do? So a neuropsychologist essentially is a trained, specialized psychologist who studies the dysfunctions of the brain and then how that affects the way we feel, think, and behave. Neuropsychologists in hospitals, they work in collaborative teams, and one of my co-op programs, actually, I was a neuropsychology intern, and I saw that was a very collaborative environment. So they're working with doctors, neurologists, psychiatrists, psychologists, nurses, so they're not really on their own, but they're doing different types of psychological testing and essentially giving those results to other people as well so that they can serve the patient better. And finally, a sample population that neuropsychologists work with is individuals with dementia. So for example, Alzheimer's disease, many times the patient will go in for an fMRI, for a CT scan, but they will want additional information, and they'll get referred to a neuropsychologist to basically test them for memory loss, for attention loss, for language impairments, etc. Okay, so you might be thinking, what about functional imaging? So nowadays we have fMRIs, we have very advanced forms of neuroimaging techniques. You can just put a person into the scan, you can see what's going on in the brain, and you'll know basically, okay, this is what's impaired, and therefore they're acting the way that they're acting. However, if you remember the disclaimer from the second or third slide, I mentioned that just because one part of the brain is not intact does not mean that it's relating specifically to that behavior. So definitely, fMRIs are very helpful, but as a neuropsychologist or within the field of neuropsychology, we don't want to just know where the damage is, but we want to know how it relates to behavior. Okay, so I move on to just some of the goals of neuropsychological testing, and these actually were formulated in 2003 by Seidman and Bradler, Bruder, and they basically formulated about 7 different goals of neuropsychological testing. And it's really important to look at any test, so I'm focusing primarily on neuropsychology here, but there's the DSM, there's the MMPI, there's intelligence scales, there's so many different tests out there, and when doing a test, when conducting a test with a patient, as a psychologist, as a clinician, you really need to know your goals. You can't just be administering tests for no reason. You have to know the reason as to why you're administering the test that you are. So number one, the purpose of, or the goal rather, of neuropsychological testing is to reliably measure the behavioral correlates of brain dysfunction. So someone comes in with Alzheimer's, with stroke, with a traumatic brain injury because of a car accident. We don't want to just know what's happening in the brain, but we want to know how it's causing behavioral dysfunctions as well. Secondly, we want to establish possible localization as well as the location of the brain lesion in the brain by looking at the behavioral results. Third, we want to identify the characteristic profile that is associated with a neuropsychological syndrome. And this is really important in terms of differential diagnoses. So we talked about fMRIs earlier that, let's just say a patient goes in for a scan, they come out and the doctors are confused whether it could be dementia or whether it's just amnesia of another type. So a neuropsychologist will do additional tests to basically rule out the possibility of another diagnosis. Fourth, another goal of neuropsychological testing is to determine whether neuropsychological deficits are present. So we're talking about cognitive deficits, perceptual, motor, sensory, language, emotional. So we really want to pinpoint where the deficits are. And 3 more to go. So number 5, to describe neuropsychological strengths, weaknesses, and strategy of problem solving. And this, again, as a co-op student, I saw this a lot in many of the patients, that they would come in and the way that they would think would be very different from when they had the stroke to when they were perfectly healthy. So their strategy of problem solving, the way they would even do the tests, was very different. Number 6, we want to assess the patient's feelings about his or her syndrome. So again, remember, neuropsychology, there is a psychology bit. In psychology, of course, we do care about the way the patient is feeling, what they are thinking. So we do have that sort of counseling piece there as well. And finally, the goal of neuropsychological testing is to provide treatment recommendations. So many times people think that they're suffering from a memory problem, but after doing 20 different tests, the neuropsychologist finds out it's actually an attention problem. So we're not going to give them treatment or therapy for memory disorders, but rather we'll focus on attention. Okay, so there's several methods of testing when you are going to a neuropsychologist, for example. The first form that I've listed here is interviews and behavioral observations. So first and foremost, the patient will come in, we'll do a clinical interview with them, and we'll also just observe them. So are they blinking a lot? Do they have normal posture? Are they fidgeting? Are they sweating? So we'll look at all these behavioral types of observations as well. Secondly, psychometric tests are also part of the neuropsychological assessment. So this includes things like IQ skills. Thirdly, this is the most common one. This is the one that I'm most familiar with as well, and I've done several different types of standardized neuropsychological tests. And this is essentially a battery, and it could be from 20 tests to 50 tests. So it takes about 3 to 5 hours to do the whole test. So it's an entire battery of different types of standard neuropsychological tests. And of course, we have the unstandardized clinical tests, and every clinic, every hospital has some of these as well. They're not really standardized, but they're just sort of created these tests for the specific population. Okay, so we'll go into some commonly used tests as well. We're not going to go into each of them. I just have sort of the tests illustrated here to show you that there's different types of tests. And I mentioned that there's one battery that has 20 tests, but we're going to talk about only a few here due to limitations of time. So an example of a test that you can see here is the Wisconsin card sorting test. And this essentially tests for several different types of cognitive impairments like attention, being able to match color, number, shape, numeracy, language skills, how fast you're able to do it, so processing speed, all these different things. And every single test actually measures something different with regards to our cognitive abilities. We also have the digit span. This is one of my favorite tests. I would do this with the patients all the time. And digit span basically is when the neuropsychologist says a few numbers and the patient is required to say them back. So for example, I'll demonstrate it for you right now. I'll say 783. So you have to say back 783. So there's a forward digit span and a backward digit span as well. And this is primarily testing the patient for short-term memory loss as well. So it's a very interesting test. It's very interesting to see the results that come out of a test like this one. We have the WAIS as well, the Wechsler Adult Intelligence Scale. This is one of the most popular IQ scales that are out there. And I know there's been a lot of criticism about IQ scales, so we don't use this just on its own, but a full comprehensive neuropsychological assessment will have an IQ scale, but it will have other tests as well. We also have something like the tactile performance test, and now you might think this looks like toys and blocks, but this is exactly, essentially what a neuropsychological test is. It's very tactile. There's paper pencil type tests, but there's also tests like this one. So you're matching shapes with color, and this is really testing for motor and sensory perception, and motor movement as well. We also have something like the trail making test. This is more of a paper pencil type of test. So in this test, we ask patients to basically go in order, in sequential order, from number, letter, number, letter. And this test essentially is looking for visual spatial functioning. And finally, we have the clock drawing test. Again, a very interesting test, and this is looking at problems of attention. So if we're not really sure the patient is suffering from attention or memory problems, this is an excellent test for that. And interestingly, just in my experience working with a geriatric population, many patients are not able to draw a clock after suffering from a stroke or traumatic brain injury. So you might be thinking, okay, drawing a clock, it's a very easy thing. There's 12 and 3 and 6 and 9. It's such an easy thing to do. But actually, many of the clocks end up looking like these two. So they miss out the numbers. If you tell them, okay, can you draw 10 p.m.? The hands will be all wrong. So it's very interesting to see sort of the amount and the level of impairment that the brain injury has caused. And finally, we're just going to end off with some causes of brain injury. So when would you actually need a neuropsychological assessment? We talked about this earlier, that there are so many different types of tests and assessments within the world of psychology. So why a neuropsychological assessment? So patients essentially who've been in a car accident, for example, and who've suffered from a traumatic brain injury, or perhaps have had a lesion, a brain tumor, individuals with Alzheimer's, with stroke, these are the primary types of individuals who come for and who are referred for neuropsychological assessment. Because again, the condition is related to the brain, but we want to know how will it impact their behavior and their cognitive functioning as well. So I just wanted to end off there with a reference. So all of the references that I used in this PowerPoint was from a book, Abnormal Psychology by Davison et al., and this was in 2005. So all my references were from here as well. And if there's any additional references that you would like for any of the content I presented, you can definitely let me know as well. Jazakallah khair. We will end here. Subhanakallahumma wa bihamdika. Nashhadu an la ilaha illa ant. Nastaghfiruka wa natubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.